So I'm Christophe Cornu from the section of Health and Education at UNESCO. I think that the priorities for the UNESCO chair on global health and education should be the following. I mean, obviously, I'm talking from the perspective of UNESCO. At UNESCO, we support our member states in the area of health and education, and we're supposed to provide them with guidance on what works, what doesn't work, based on the best evidence, based on best practice. So we would expect from the chair that they tell us what the best evidence is, what works, what doesn't work when it comes to different areas of health education. And so that's one thing, really, for us to be able to provide guidance to our member states and explain to ministries of education and ministries of health what they should do. But the other thing that is important is that in many occasions it's difficult to define what evidence is and what best practice is. And we have a few key principles at UNESCO. One of them is that everything we recommend should be evidence-based, but also that it should be culturally sensitive. And I think that the chair can help us define what is evidence in a world that is global, but where there also are still very many cultural and social differences. And what works in one context might not work in another context. And we need to understand why, and we need to understand the implications of recommending best practice to different countries and different regions. So I think that's going to be something very useful coming from the chair. And a third very interesting outcome that we would like to see from this chair would be to bring together researchers in health and education, and practitioners from different regions and different countries again, and help them work together to make sure that the interventions, the programs at country level are based on evidence. Now, in terms of what works to prevent NCDs, I think that based on our experience, here at UNESCO, having worked on different areas of health and education, we know that social and emotional skills are something that are common to most successful interventions to prevent for example, the use of alcohol, tobacco, and drugs. We had the opportunity to work together with UNODC and WHO on education sector responses to the use of alcohol, tobacco, and drugs. And we saw that strengthening the social and emotional skills of children is really something that makes a difference. And we've seen that for other health issues. So that's really something that we think works. Obviously, this is what should be taught to how, but there's also the issue of how social and emotional skills are taught. And that's the issue of classroom management, of teaching, and we know that it's absolutely essential to train educators because many educators have no clue how to train or how to strengthen the social emotional skills of children. Very often, teachers know how to teach contents and how to provide information. But obviously, when you talk about successful health education, it's very much about interactive methodologies, which means that teachers have to be trained in these methodologies. They have to be trained in how to manage a classroom properly. Not everything is in the curriculum. It's also in the way is the way education is conducted. So based on our experience, we know that that's definitely something that makes a huge difference in preventing NCDs.